How do you get diagnosed with Tourette's? When should you go to the doctors? What's that process like? And how can you prepare? For all of that and more, keep watching. Welcome to Boneitch. If you are new here, hi, my name is Luca and I make videos about what it's like to live with Tourette's. If you are interested in topics like that, please subscribe and hit that notification bell so you'll get notified whenever I upload a new video. Today we're going to talk about the process of diagnosis. Getting diagnosed with something like Tourette's can be a scary and lengthy process. I can know because I was well into my 20s before I finally got that diagnosis. So today I want to talk about that, what that whole process is like, when you should consider to go to the doctors, what to expect, how to prepare, all that stuff. But first, a disclaimer, of course, I'm not a medical professional, and even a medical professional should not give you medical advice through a video. This is just my thoughts from the perspective of someone with the lived experience of Tourette's and getting diagnosed with Tourette's. So take whatever I'm saying with a grain of salt and go to an actual medical professional, go to your own doctor for actual medical advice, okay? All the sources that I've used writing out the script for this video will be in the description box below as well. So you can do some more reading if you have any questions or interested in doing some of your own research. This video is going to be a bit more informational. I'm not really going to talk a lot about the issue of the medical field not taking some people, especially women, seriously when they go to the doctors with tics. I made a video about that specifically last week, so you can check that out. It's going to be in the card right here or in the description box as well. So yeah, let's get into it. Let's start with the basics. What is Tourette's? Tourette's is a neurological disorder and its main characteristics are tics, and tics are involuntary sounds and movement. And those tics can be very simple. They can be blinking or flexing a muscle, or with vocal tics they can be coughing or scraping your throat or a small sound like that. But they can also be more complex, like shouting whole words, making more elaborate movements like that. And contrary to what you would believe if you see what Tourette's looks like in the media, only 15% of people with Tourette's have swearing tics, or coprolalia, what is officially called. In order to classify as having Tourette's, you need to have at least 2 motor tics, so anything to do with movement, and 1 vocal tic, anything to do with sound, for at least a year. But those tics don't have to be there all of the time. They don't have to be there simultaneously. Sometimes tics come and go. Every person's tics are going to be different. If you experience tics but don't fit some of the other criteria for Tourette's, you might have another tic disorder. There are other tic disorders out there as well. If you are interested in learning more about that, I made a video about the differences between the different tic disorders, which will also be in the card above. And you can learn more about the different diagnostic criteria for the different tic disorders if you are interested in that. Now, there are also conditions that cause tic-like symptoms that are not actually a tic disorder, such as functional movement disorders, things like that. In the video that I made last week, I also talked about FMD. if you'd like me to make a video specifically about functional tics, about psychogenic tics, let me know in the comments, and I'll do some research and make a video specifically about that. But today we're going to talk specifically about getting diagnosed with a tic disorder, or Tourette specifically. So you think you or your child, for example, might have Tourette's. When should you go to a doctor? Again, disclaimer, I'm not a doctor. I can't tell you whether you should go to the doctor. I can't give you medical advice. For medical advice, you should go to the doctor. So if you're looking for medical advice, you should go to the doctor. So that should be clear, all right? I get that it might be difficult to measure whether your tics or your child's tics are severe enough to go to a doctor. And yeah, tics are very common, especially in children. And most of the time, it's just a very small thing and they come up and then they go away again. And it's not something you should have to worry about. So please don't panic the moment you or your child starts having some small tics. Most of the time, those tics don't interfere with your life and they go away on their own. If your tics are not causing any problems, you might not need to see a doctor, or not yet. However, you probably didn't start watching this video unless you did have some. However, you probably didn't start watching this video because you didn't have some worries about your tics or your child's tics. And I think you should go to your doctor, to your GP in general, when you feel worried about some symptom. In general, the advice is to go to the doctor if your tics occur very regularly or become more frequent or severe, if they cause emotional or social problems such as embarrassment, bullying, or social isolation, if they cause pain or discomfort. Some tics can cause the person to accidentally hurt themselves, if they interfere with daily activities or school or work, or if they are accompanied by anger or depression or self-harm. Also, even if you don't feel like you want to get treatment for your Tourette's or for your tics, again, most of the times tics and tic disorders are very benign, and if you don't want to get treatment, that's fine. I don't get any treatment for my Tourette's. Not because I'm against it or anything, just because I'm already on so much medication that I didn't feel like adding more medication to it. And at this point, I'm all right with how my tics are. But still, I think it's important to go to the doctor when you have tics that are very prominent, or when they get more severe, or when you start having tic attacks, because sometimes tics or tic-like symptoms can be caused by other conditions that do need medical intervention, such as encephalitis, epilepsy, Huntington's disease. And I'm not saying this to scare you. I can imagine that might be scary to some, but I hate for people to watch my video and just assume that they have a tic disorder and not go to the doctors when they actually had something else and they really should have gotten that checked out. So please take tics seriously. Even if you don't want to get treated for it, if it is Tourette's or if it is a tic disorder, please be safe. I mean, I want you to be safe, truly. And I think that if you find yourself worried and researching and going over this stuff, you probably should go to the doctors, because just to give yourself that peace of mind. The outcomes could be either you have it and then that's it, or you don't have it and you don't have to worry about it as much anymore. So if you are worried at all, please go to the doctors. So about getting diagnosed, what can you expect? How can you prepare? Of course, this is going to differ from country to country. In countries like the UK or the Netherlands, you can't book an appointment with a specialist yourself. You have to go to a GP or a family doctor and they will refer you to a specialist. So if you are in any of those countries, if that is what the medical system is like for you, you have to book an appointment with your family doctor or your GP and see if they can refer you to a neurologist. And even though most family doctors and GPs should be able to recognize tics and suspect Tourette's or other tic disorders, I know that the reality is that even in the medical fields, Tourette's and tic disorders are still not well known enough, not recognized enough. So if you are worried that your GP or your doctor won't take you seriously, I'd advise you to prepare, to write down everything. Write down your symptoms, the things you're worried about, what you wish to get from the appointment, and what you want to say in general. If you are a parent of a child that has tics, you could maybe video the child when they are ticking. That was some advice that I saw on some websites. In general, I don't like it when parents video their children having tics and post it on the internet and ask, is this Tourette's? Please don't do that. I think that's quite a harmful thing to do because a child cannot consent to that. And I think in general, posting videos of your children on the internet is not a good idea. And people on the internet cannot and should not give you advice on whether or not what your child has is Tourette's. But you could use that video to show to a doctor and explain this is what's happening. I think that's a very valid reason to make a video of your child, or maybe video it yourself if you're talking about your own tics, if that is something you're comfortable with. You could, when you are going to the doctors, you could also bring maybe a friend or family member that can kind of vouch for you. Sometimes it's difficult to talk about your own symptoms when you start talking to a stranger, to a doctor, and I get that. So maybe you can have a friend with you that will be able to vouch for you, to stick up for you, to explain the things that you might be nervous talking about, or just give you some of that support just by being there. Because I know what it's like when your doctor doesn't really take you seriously, and how you can kind of undermine yourself when you're scared of that. I even have that. I have asthma, and sometimes my breathing will get so bad that I have to go to the doctors. But when I was young, my doctor did not take my breathing issues seriously. So they would just assume that I was panicking or something. So now every time I have to go to the doctors because I can't breathe, because I'm so nervous, I'll have so much adrenaline in my system that the moment I walk into the doctor's office, I can breathe just fine and I'm fine and there are no problems. But then I walk out and I can't breathe again. So I get what that's like. So if you feel that might happen to you, that you might have trouble explaining yourself, prepare, write stuff down, maybe bring along a friend and stuff like that. Anyways, you're gonna go to your family doctor or your GP not to get your diagnosis, but to get referred to a specialist. In most cases, that will be a neurologist, and in some cases, that might be a psychiatrist or a psychologist. Especially with children, it might be a child psychiatrist or even a child psychologist. It's not because they think it's a mental disorder. Tourette's is not a mental disorder, but Tourette's can be diagnosed by a psychiatrist, and especially with children, therapy can really help with the social issues and the bullying and fear and everything that comes along with Tourette's. And also most people with Tourette's will also have another disorder like OCD or ADHD, something like that. And a child psychiatrist may be better equipped to help a child with that. I think especially in the Netherlands. I think in most other countries as well, as an adult, you'll be referred to a neurologist, but it might be a psychiatrist as well. So don't be worried when your doctor decides to refer you to a psychiatrist. They are also able to help you with that. So that's all fine. If you are able to book an appointment with a specialist directly, so you don't have to go through a GP and you don't know who to make an appointment with. In general, every neurologist should be able to diagnose you with Tourette's, but again, not all neurologists, not all psychiatrists are specialized in tic disorders specifically. And most Tourette's associations will have lists of specialists, so neurologists, psychiatrists, and some psychologists on their websites that are part of like an advice board or something like that, that will definitely be specialized in Tourette's. So if you're able to book an appointment with them, then at least you know that you are in the right hands. If you are going to your GP and you really want to go to a specific neurologist, for example, in the Netherlands, the Dutch Tourette's Association also has this list on their website, and I use that list and I asked my doctor, can I please go to this neurologist? Because I think that they will be best equipped to help me, and they did, and that was fine. If your country does not have a Tourette's association, or it does not have such a list, you could go to one of the many Tourette's Facebook groups and ask if anyone knows any of the neurologists or specialists in your area, and they might give you some advice. But in general, every neurologist should be able to properly diagnose you with a tic disorder or Tourette's. Now, what will happen when you get to the neurologist? There isn't really a specific test for Tourette's. There's no like brain scan or blood test. So there's not going to be anything specifically to tell you 100% yes, it is Tourette's. But the neurologist will most likely ask you a lot of questions. They'll do basic physical examination to see if your nerves are all right. They will ask you some questions about your family history, about your tics, what you experience, how long you've had them, things like that. If you have any of the other comorbid disorders such as ADHD. So there'll be loads of questions, some basic physical examination. There might be some additional tests done, like to check whether you have any of the other medical disorders that I mentioned in the other parts, about other disorders that might be causing your tics. And if you are worried that your tics might not be caused by a tic disorder, but by something different like epilepsy or something like that, and you're worried about that, tell your neurologist that so they can rule that out and test you if necessary. Don't feel scared to ask for that, because if you're worried about that and you leave the office of the doctor worried, then that would be such a shame, such a waste. That's not why you went there. They are there to make sure that you are healthy, and if you're worried about something, bring that up and they will be able to help you with that. So after that examination, your neurologist will either tell you that you have Tourette's or another tic disorder or not. And if they tell you that you have it, they will probably give you some more information about possible treatment. They'll ask you what you want, if you want to have therapy or medication, or if there are any questions that you have. There are different options for different people. Therapy can work for some people. Cognitive behavioral therapy can work, but also therapy to deal with some of the emotional problems that come with Tourette's and tic disorders can really help if that's something that you're interested in. There are medication options. So that's something you can discuss with your doctor if that's something you're interested in, if you want to try that out. There are other options like Botox, there's surgery in some cases. So there are loads of options, but even if you don't want any treatment, getting diagnosed can really be worth it. When I went to get diagnosed, I didn't really want treatment necessarily. I was just very worried. I started to get, I had tics all my life, but I started to get tic attacks all of a sudden. And I wasn't sure that it was Tourette's. And just not knowing for sure made it so scary, not knowing what a tic is, and all of a sudden you're not being able to control your body and your movement is terrifying. So getting that diagnosis was a relief for me, because then it made sense and things started to fall into place, and I could accept myself as this is what I have, and it wasn't something to do with my character. I belong in the Tourette's community. It was such a validating thing. So even if you feel like you don't want any treatment, which is very valid, getting diagnosed really helps put that worry aside and know what's wrong, and know that if it gets worse at some point, you have that piece of paper that already says, yeah, this is what it is, and now it's getting worse and I need help. Yeah, it's really worth it. That's honestly. Now, I do want to talk about self-diagnosis very quickly, and self-diagnosis is not an easy topic. I think, like in general, in a perfect world, self-diagnosis is a bad idea because we are usually very bad at assessing ourselves. There's a reason why doctors don't diagnose themselves. They have to go to a doctor as well. And yeah, I think that in general, if you can, you should go to a doctor. But I know that for some people, that's not realistic. And in some countries, going to doctors is very expensive. In some countries, if you are under 18, you can't go to a doctor unless your parents allow you to. And then some parents don't take the medical or the health of their children seriously enough to allow them to go. And I understand that. And I just want you to know that you are valid no matter what your specific diagnosis is. If you are experiencing tics, that's your experience, that's your lived experience, and that's valid. That label, that diagnosis is just a category for specialists to put you in to better treat you. And it shouldn't be a badge of honor for people to wear. If you are experiencing tics, you are valid in my eyes, you are valid, you're welcome in this community. And getting diagnosed should be for your health and not for some like social, cultural points that you can achieve. We are not some niche group that you can only get into when you have an official piece of paper. I don't care about that. If you have tics, and whatever your tics are coming from, and you have this experience, you are valid and you belong here. You should go to the doctors for your health, not for anyone else. All right? Anyways, that's all I wanted to say. Let me know what you think. I love you all so much, and I'll see you next week. Bye.